The Lachman test is done to check for an ACL injury or tear. The Lachman test is performed by having the patient lie on his or her back, flex the knee at a 20 to 30 degree angle, make sure the hamstring is relaxed. Then firmly grasp the femur with one hand and place the other hand behind the proximal tibia. Firmly pull, displacing the tibia upon the femur, looking for the amount of anterior displacement. This test checks for ACL injuries.
The empty can test is a test used to diagnose shoulder injuries. Specifically, this examination is to examine the supraspinatus muscle and tendon. The empty can test is done by having the patient extend their arms at a 45-degree angle and having them point their thumbs down. Put pressure on the patient's forearm and push down and hold it. If the patient is having pain, that is a positive sign for a shoulder injury.
The Tyler toe test is done to examine the ankle for injury of the anterior talofibular ligament and the calcaneofibular ligament. Have the person place his foot in supine position. Intertwine your fingers and with the wide grip place them around the calcaneus. Move the foot in adduction to test the integrity of the calcaneofibular ligament. This test is done to check for heel injuries.
The valgus stress test is used to determine if there's damage to the medial collateral ligament of the knee. First, you're going to have the patient lie down in supine position. With one hand, grab onto the lower leg just above the ankle. With the other, use it to fixate the femur. Slightly externally rotate the tibia and perform passive abduction in the knee joint and thus putting stress on the medial collateral ligament.